Hello everyone! Today we are going to talk about neuroblastoma. Have you ever heard about cancer called neuroblastoma that affects children? Almost 90% of neuroblastoma is found in children younger than 5. Today's video will be about neuroblastoma, which is one of the cancers that mainly affect children and infants. Neuroblastoma are cancers that start in early nerve cells called neuroblasts of the sympathetic nervous system. The topic may seem a little strange, but do not worry. We will explain everything related to this disease, whether it is symptoms, how to diagnose it, and the treatment for this cancer. Our role today is to answer all of your questions about neuroblastoma. Today, we have Dr. Lee, who is leading doctor at Seoul St Hospital. He is going to discuss with us everything about neuroblastoma from an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Good morning, Dr. Lee.
Good morning.
Please introduce yourself to us.
My name is Jae-wook Lee. I work here in the Division of Pediatric Hematology Oncology in the Department of Pediatrics at Seoul St. Mary's Hospital, part of the Catholic University of Korea, here in Seoul, South Korea.
Perfect. Dr. Lee, so what is neuroblastoma?
Yes, so neuroblastoma is the most common extracranial solid tumor in children and is a tumor that derives from early neural tissue.
Okay, second question. Why does neuroblastoma occur most often in young children and not older ones?
Yes, so neuroblastoma is usually diagnosed in very young children, sometimes in infancy. And that is because the main tissue element of neuroblastoma, the neuroblast is most commonly found in either the fetal status or in the very early stages of childhood. That is when the neuroblast cells differentiate into normal neural tissue. So I think in answer to the question of why neuroblastoma is most commonly found in early childhood, it's because that is when the cancer predisposing neuroblast cells are most often found.
So what are the risk factors and causes of neuroblastoma?
There are no known real environmental risk factors for neuroblastoma. Important causative factors that are known so far include certain genetic abnormalities that may predispose towards the neuroblast cells to keep proliferating rather than differentiate into normal neural tissue.
So does neuroblastoma have any symptoms or signs?
Yes, so the main symptoms of neuroblastoma include, the most common site of neuroblastoma is the adrenal gland, as well as the paraganglion chain within the abdomen or thorax. So the most common symptom of neuroblastoma, I think, would be a palpable abdominal mass or abdominal pain. So symptoms relating to the abdomen of the child.
Okay. How about the diagnosis of neuroblastoma?
So diagnosis would usually require a biopsy of the primary site. So in order to obtain a definitive pathological diagnosis. However, in certain cases when the pathological specimen may not be obtained, we can undertake a confirmed diagnosis through a bone marrow aspiration as well as urine studies if the disease has spread beyond the primary site.
The classifications of neuroblastoma.
So in terms of classification of neuroblastoma, I think one could think of the histological classification, and that really depends on the amount of differentiation found within the neuroblastoma tissue, as well as the tendency towards proliferation. So the histological classification really depends on these factors.
So what is the risk group of neuroblastoma?
Right, so in terms of risk group classification, the current classification divides into 4 risk groups that depend on the age at diagnosis of the child, as well as the pathological features and the genetic abnormalities that may be found within the tumor.
How about the prognosis?
So the outcome after treatment has improved significantly in the past decade, so that in terms of low or intermediate risk patients, overall survival is above 80 or 90%. However, for the high-risk patients, that is patients who have metastasis beyond the primary site, for these patients, the outcome still remains poor at around 50% survival despite therapy.
So lastly, what are the treatments done for neuroblastoma?
Right, so in terms of therapy for low-risk patients, curative surgery alone may be the only treatment required. For intermediate risk patients, these patients usually require surgery as well as chemotherapy. For high-risk patients, these patients require a multimodal therapy in terms of surgery, chemotherapy, local radiation, and recently high-dose chemotherapy and autologous transplantation.
Today we learned many things about neuroblastoma, and the doctor explained in details everything related to this interesting topic. Thank you for joining us again at CloudHospital TV. If you have any questions or comments, please leave them below and respond to you as soon as possible.